Okay, we have another case study from Michael Kessler. If you take it away.
All right, I'm great. It's great to be back. Thanks for inviting me, Mark. And this one is a really good one. This is a traumatic brain injury. This is case number 2. And here it is. Objective tools for tracking brain degeneration to regeneration using the brain gauge and HeartQuest. Now, this case is a case where the person has a TBI and PTSD. He's got both. And this is the little time frame here. This is the history. He was on a tour in the desert in Iraq, I believe, and his vehicle ran across an IED, and it got blown up, and he had a TBI with a concussion. Okay, that was 2011. We hit 2012, and he fell off a ladder, had a seizure. Okay, we go to 2012. He does a second tour, and there it is. A guy in front of him steps on an IED, and he gets blown back. And my patient here gets blown back as well, and is just completely unconscious and has a mild TBI. Okay, probably not even a mild one, maybe. And then what happens is, he's got PTSD, he's got a traumatic brain injury, and he's starting to use some substance, some drugs to get through that whole episode, and that was 2012, 2013. So he's doing, a little substance abuse there. And 2015, he has a second seizure. So, obviously there's some things going on with this person's brain. He's taking Cymbalta at 20 milligrams 2 times a day for the last 2 years, and is also taking some CBD to calm things down. Now he's substituting sugar for alcohol. So he comes in to see us, and we start to change his program. And here's what happens. Okay, so I'm going to move this out of the way just a touch there. And he has difficulty slowing down and relaxing, has a tendency for anxiety. Considers himself a type A personality. Now we get into the good stuff here. If you look on the left, that 6-12-18 on the bottom, that's the first time we started to work with him, and we got a baseline. And you can see the reaction time is really low. Temporal order judgment is really low because he's had brain trauma, right? That makes sense that would show up. Connectivity is pretty low. And, the rest of what you see there, fatigue, focus. Cortical calmetrics is really an overall looking at all the parameters here. And it's low, it's 50. You go to the next one after we start treating him up to 7-25-18, which is the middle one there, and you can see everything is starting to improve. And it's amazing. It's just a beautiful thing to be able to see that visually and objectively, right? And then if we keep going with the treatment to 9-11-18, look at that. It's just almost all across the board. There are beautiful numbers improving. The person's symptomology is improving. He's feeling better, and it's reflected in those scores. So just look at the cortical calmetric. It went from 50, went to 80. Now it went to 91. Just amazing. I'm not going to go into too much depth here on this, but again, we like to look at the healthy averages, comparing our patient to what the concussed averages in this case, and what his scores are. So we go across each one of these looking at that. Without going into too much depth, I can tell you that the scores are improving as we go into each of these different subsets here of measuring at these particular dates. But if you look down at the last one of the concussed average patient scores, which is his, there's still room for improvement, which is a good thing to see because you think, okay, I'm feeling better, the patient says, my scores look good, it's time to maybe end that treatment. And you say, no, based on these scores, you still need more treatment. That's important. Now, I highly recommend when you're doing the brain gauge, you also complement that with a neurotransmitter questionnaire. You can see down here at the bottom that that the neurotransmitters are a little bit off. And again, at the end of treatment, you probably want to go back and have them fill that out again. This is a great questionnaire. I just put some of these in here, and this is from Dr. Karazian's questionnaires on the brain. And these will also correspond to some of what you're going to see on the brain gauge. But if you just look at this last one, increased nervous system dominance, having difficulty in slowing down and relaxing, Let's look at the twos. The twos are a little higher, having a tendency for anxiety. And so you can see those things. And it's just great to have that in conjunction, again, with the brain gauge. Again, we did the heart quest. And with the heart quest, again, when you see all three red on those indices that measure heart rate variability in the medical literature there, when all those are lit up red, person probably needs vagal nerve stimulation to calm things down. And within the heart quest, there's these numbers, excuse me, these indices here. You can push them all the way across as you ask the questions to the patient. Like orthostatic hypertension showed up, hypotension, excuse me, tachycardia, increased blood pressure. All those things are showing up. And that's another thing that we can use to track what's going on. You can see that green part of the pie, no parasympathetic, and that's really important in calming that anxiety down. And he's all in fight or flight with that big yellow there. And the stress index is showing it's too high. So that's just an indication of too much stress on the nervous system. Just some things to look at. And here again, after we recalculate this a little bit, that brain power spectrum will be actually a little bit lower. And one more thing I just want to add here is that on the neurotransmitter balance index there, right in the middle where it says neurotransmitters, he's pushed more over to the excitatory predominance. So he's producing more excitatory neurotransmitters. And if you look at the brain gauge, you're going to kind of get a clue that maybe he needs some more calming and GABA and things like that. Usually, in this case, there would be higher beta on this side to match that. It depends on the time of the day that we're measuring. This is what we did for him. We gave him molecular hydrogen, which most of you know about that, and they drink that molecular hydrogen water, goes right into the brain and reduces oxidative stress through the antioxidant response element for using NRF2 to bring up glutathione, superoxide dismutase, and catalase, and do all the wonderful things it does. We do a neuroemotional technique on him. He was taking CBD. We gave him parent essential oils, which are fatty acids to repair, reduce inflammation, and rebuild the cell membranes. We gave him very specific probiotics to help with the anxiety. And we all know about that 60% of the neurotransmitters come from the gut. So there's how we fixed him, and there we go. I want to we want to thank you for listening. And if you want to catch Mark, he's going to be talking at this conference that we're having in Arizona, November 12th and 13th. And if you want to go to the heartquest-global.com, you can click on the conference right there where it says conference right up here. And you can scroll down and see who's talking, what type of technologies we're going to have. And we have a lot of stuff that's going to be great for the brain gauge and improving brain gauge scores at this conference. I want to thank you again.
All right, thank you. That is awesome.